How does the UHE Act's goal of an integrated and comprehensive approach? It necessitates the adoption of a unified health information system. So, the UHE Act's goal of an integrated and comprehensive approach, it requires a unified health information system, or what is called HIS, to ensure continuity of care, efficient resource use, and equitable access. A unified HIS prevents fragmented records, allows data sharing across facilities, it supports monitoring and evaluation, and it enables evidence-based decisions. This integration ensures that all Filipinos benefit from coordinated, efficient, and equitable health services. RA 11223. It mandates the creation of a National Health Data Repository, or NHDR, and requires health facilities to maintain an electronic health information system. What are the specific implications of this for nurses? It mandates of RA 11223 for a National Health Data Repository, or NHDR, an electronic health information system, has several implications for the nurses. Number 1. Documentation and accuracy. Nurses must shift from primarily paper-based to electronic documentation, ensuring complete, accurate, and timely patient records. For number 2, continuity of care. Nurses play a key role in updating and retrieving patient data, which supports seamless referrals and follow-ups across different facilities. Number 3, accountability and transparency. Digital records make nursing care more traceable, highlighting the need for professional accountability in charting and decision making. For number 4, informatics competence. Nurses need training in health informatics, data privacy, and the use of electronic systems to adapt effectively. For number 5 is patient advocacy and education. Nurses might need to guide patients in understanding how their health information is stored, shared, and protected. That's all. Thank you.
Now, the Universal Health Care Act emphasizes the role of primary care providers as the initial point of contact for patients. Now, how does this provision leverage nursing informatics? So, this setup leverages nursing informatics in several ways. So, first, we have the efficient patient data management. Nursing informatics supports electronic health records, allowing PCPs, including nurses, to access, update, and share patient information quickly and accurately. So, this efficient patient data management ensures accurate patient records. Another one is the continuity of care. So, informatics tools ensure that patient histories, medication, and previous consultations are available at the primary care level, reducing duplications and errors. So, this continuity of care supports evidence-based decisions. Another one is the decision support. Now, informatics provides clinical decision support systems that help nurses and doctors make evidence-based decisions at the point of care. So, this decision supports improve continuity and referrals. Another one is the patient management. Digital platforms and telehealth enhance communication between patients and primary care providers, encouraging preventive care and health management. So, this patient engagement enhances patient enhances patient engagement like telehealth apps. And the last one is the health system integration. So by linking primary care data with higher level facilities, informatics strengthens referral systems and resource allocation under universal health care. So this health system integration strengthens health system integration. Now those are the leverages of nursing informatics.
So the Universal Healthcare Act aims to provide accessible and coordinated health services for all Filipinos, and part of this involved creating modern health information system to provide patients of the Universal Healthcare Act works hand in hand with the data privacy of 2012 RA 10173. So the Universal Healthcare Act ensures that the personal medical data collected in the system are only used for health services, planning, decision making, while Data Privacy Act sets strict rules on how information must be stored, shared, and protected with legitimate health purpose. So this means that health facilities and government agencies must put in place safeguards like secure database, control access, and proper consent from patient before sharing data. So both laws require accountability. Health workers and institutions must respect the confidentiality, and any misuse or unauthorized disclosure of the patient's information can be lead to penalties. So in short, the Universal Health Care Act creates the framework of National Health Information System, and the Privacy Act provides protection mechanism to make sure the patient information stays safe and private and used only for legitimate health purposes.
How has the UHC Act spurred a need for changes in nursing, education, and training in the Philippines? The UHC Act has shifted the focus of nursing education and training in the Philippines from hospital-centered, curative care toward primary health care, community-based practice, expanded rules, health system knowledge, and professional collaboration. This means future nurses must be trained not only as bedside caregivers but also as health educator, leaders, and advocates for equitable and accessible care. So these are the changes in nursing education and training in the Philippines. So first, shift to primary healthcare and community-based service. So the UHC emphasizes primary healthcare, health promotion, and disease prevention over hospital. So base care, this requires nursing education to focus more on community and public health, equip nurses with skills in family-centered care, health education, epidemiology, and teamwork for service in local health facilities. And second is competency in health system and policy. So nurses must be understand health financing, referral system, and services integration. So nursing education now emphasizes health system management, leadership, and policy advocacy to support UHC implementation. So the third one is expanded rules and advanced practice. So UHC promotes nurse lead services requiring training in advanced assessment, care management, and expanded clinical competences for advanced practice care. So the fourth one is emphasis on equity and accessibility. So the nurses must be ready to serve marginalized and remote communities. So nursing education emphasize cultural competence, disaster response, mobile health, and telehealth for inclusive care. So the fifth one is interprofessional and team-based care. So UHC promotes team-based care. So nursing education highlights collaboration with other health professionals and uses simulation and care-based learning to build teamwork skills. Six, continuous professional development. So UHC requires nurses to adapt to involving health needs, making lifelong learning and CPD programs in areas like informatics, telemedicine, chronic care, and health promotion essential. So that's all for our group reporting. Thank you for listening.